Welcome to this comprehensive NCLEX practice session focused on gynecology. In this set, you will find 50 carefully crafted NCLEX-style questions that cover essential gynecological concepts, from common disorders and diagnostic tests to critical nursing interventions. Each question comes with a detailed rationale and strategy to help you not only understand the correct answer but also strengthen your test-taking skills. This resource is designed to boost your confidence, sharpen your critical thinking, and prepare you for success on the NCLEX exam. Question 1. A 32-year-old woman presents with irregular menstrual cycles. Which hormone is most responsible for regulating ovulation? A. Progesterone. B. Estrogen. C. Follicle-stimulating hormone, FSH. D. Oxytocin. Answer, C. Follicle-stimulating hormone, FSH. Rationale, FSH stimulates follicle development in the ovaries, essential for ovulation. Estrogen and progesterone regulate the uterine lining, oxytocin stimulates uterine contractions. Strategy, for ovulation, always think FSH and LH. Question 2. A nurse is teaching a client about pap smears. Which statement indicates correct understanding? A. I only need a pap smear if I have symptoms. B. Pap smears are used to detect cervical cancer early. C. Pap smears are used to diagnose ovarian cancer. D. I don't need pap smears once I start menopause. Answer, B. Rationale, pap smears are a screening test for early detection of cervical cancer, not ovarian cancer. They remain important even after menopause. Strategy, differentiate screening versus diagnosis. Question 3. A client with endometriosis asks why she has pelvic pain. Which explanation is best? A. The uterine lining grows only inside your uterus. B. Endometrial tissue grows outside the uterus and bleeds during your cycle. C. You are not producing enough estrogen. D. The pain is related to ovarian cysts. Answer, B. Rationale, endometriosis involves ectopic endometrial tissue that responds to hormones, causing cyclic pain. Strategy, connect endometriosis equals ectopic bleeding tissue. Question 4. Which finding is most concerning in a suspected ectopic pregnancy? A. Amenorrhea. B. Unilateral abdominal pain. C. Vaginal spotting. D. Shoulder pain with shock. Answer, D. Rationale, indicates rupture and internal bleeding, life-threatening emergency. Strategy, prioritize shock signs in emergencies. Question 5. Oral contraceptives are contraindicated in which condition? A. Hypertension. B. Dysmenorrhea. C. Acne. D. Regular menstrual cycles. Answer, A. Rationale, they increase clot risk, especially in hypertension, smokers greater than 35, or history of thromboembolism. Strategy, remember clot risk conditions. Question 6. A nurse is teaching about menopause. Which symptom is expected? A. Hot flashes. B. Heavy menstrual bleeding. C. Increased fertility. D. Breast tenderness. Answer, A. Rationale, menopause is marked by hot flashes, vaginal dryness, mood swings, and osteoporosis risk. Strategy, link menopause with low estrogen symptoms. Question 7. Which lab confirms menopause? A. Low FSH. B. High FSH. C. High estrogen. D. High progesterone. Answer, B. Rationale, decline in estrogen leads to elevated FSH as pituitary tries to stimulate ovaries. Strategy, think opposite balance, low estrogen high FSH. Question 8. A 50-year-old woman has a pelvic exam showing a firm, irregularly shaped mass. Which is most concerning? A. Uterine fibroids. B. Ovarian cancer. C. Endometriosis. D. Polycystic ovarian syndrome. Answer, B. Rationale, ovarian cancer is often asymptomatic until late, and a firm irregular mass is concerning. Strategy, for irregular, firm masses cancer risk. Question 9. Best screening test for ovarian cancer? A. Pap smear. B. CA-125 blood test with ultrasound. C. Mammogram. D. Endometrial biopsy. Answer, B. Rationale: CA-125 is used with ultrasound for ovarian cancer detection. Pap smear screens for cervical cancer. Strategy: match test to cancer type. Question 10. A woman with PCOS asks about symptoms. Which should the nurse explain? A. Weight loss and hot flashes. B. Infertility and irregular menses. C. Hypotension and bradycardia. D. Increased risk of fractures. Answer, B. Rationale: PCOS causes irregular menses, infertility, obesity, hirsutism, and insulin resistance. Strategy: associate PCOS with infertility plus irregular cycles. Question 11. Which nursing action is priority after a dilation and curettage, DNC? A. Encourage early ambulation. B. Assess vaginal bleeding. C. Monitor for hot flashes. D. Administer laxatives. Answer, B. Rationale: hemorrhage is the greatest risk after DNC. Strategy: post-procedure bleeding risk first. Question 12. A client has heavy menstrual bleeding. Which lab is priority? A. Hemoglobin and hematocrit. B. Electrolytes. C. Liver enzymes. D. Glucose levels. Answer, A. Rationale: excessive bleeding risk of anemia. Strategy: think blood loss, check HB/HCT. Question 13. Which finding after hysterectomy requires immediate intervention? A. Moderate pain. B. Vaginal spotting. C. Absent bowel sounds. D. Saturating peripad in 30 minutes. Answer, D. Rationale: rapid bleeding suggests hemorrhage. Strategy: excessive bleeding equals emergency. Question 14. Which statement indicates understanding of breast self-exam, BSE? A. I will perform it weekly. B. I should do it the same day each month. C. I only need to do it if I feel pain. D. It replaces mammograms. Answer, B. Rationale: BSE should be performed monthly on the same day. Strategy: link BSE to monthly schedule. Question 15. A client with cervical cancer asks about HPV. The nurse responds. A. HPV infection is strongly linked to cervical cancer. B. HPV only causes ovarian cancer. C. HPV has no effect on cancer risk. D. HPV causes breast cancer. Answer, A. Rationale: HPV is the strongest risk factor for cervical cancer. Strategy: remember HPV cervical cancer. Question 16. Best vaccine for HPV prevention? A. Varicella vaccine. B. Gardasil. C. Hepatitis B vaccine. D. MMR. Answer, B. Rationale: Gardasil prevents HPV strains causing cervical cancer and genital warts. Strategy: match HPV Gardasil. Question 17. Which condition causes severe dysmenorrhea in adolescents? A. Endometriosis. B. PCOS. C. Uterine fibroids. D. Cervical cancer. Answer, A. Rationale: endometriosis often starts in adolescence and causes severe cyclic pain. Strategy: dysmenorrhea in young women. Endometriosis. Question 18. Nursing priority for ovarian cyst rupture? A. Pain assessment. B. Monitor for internal bleeding. C. Encourage oral fluids. D. Document menstrual history. Answer, B. Rationale: risk of hemorrhage is highest. Strategy: post-rupture assess bleeding. Question 19. A woman with fibrocystic breast changes should avoid. A. Caffeine. B. Vitamin E. C. Supportive bras. D. NSAIDs. Answer, A. Rationale: caffeine worsens breast tenderness. Strategy: for fibrocystic breasts avoid caffeine. Question 20. Which finding is concerning in postmenopausal women? A. Hot flashes. B. Vaginal dryness. C. Postmenopausal bleeding. D. Mood swings. Answer: C. Rationale: always abnormal, may indicate endometrial cancer. Strategy: bleeding after menopause equals red flag. Question 21. Which finding should the nurse expect in a client with pelvic inflammatory disease, PID? A. Severe dysuria and hematuria. B. Lower abdominal pain with fever and vaginal discharge. C. Irregular breast lumps. D. Abdominal distension without pain. Answer: B. Rationale: PID causes pelvic pain, fever, and purulent vaginal discharge, often linked to untreated STIs. Strategy: associate PID with infection signs plus pelvic pain. Question 22. Which client is at greatest risk for developing cervical cancer? A. A 40-year-old woman who is nulliparous. B. A 25-year-old woman with multiple sexual partners and HPV infection. C. A 50-year-old woman with no family history of cancer. D. A 30-year-old woman with fibrocystic breast disease. Answer: B. Rationale: risk factors include HPV, multiple partners, and early sexual activity. Strategy: think HPV plus sexual history equals risk. Question 23. Which instruction is most important for a woman after a colposcopy? A. Avoid tampons and intercourse until discharge stops. B. Take daily aspirin to reduce bleeding. C. Expect heavy bleeding for 1 week. D. Stop all physical activity for 2 weeks. Answer: A. Rationale: to prevent infection and irritation, avoid tampons and intercourse until healed. Strategy: post-procedure infection prevention priority. Question 24. Which client statement indicates a need for further teaching about intrauterine device, IUD? A. I should check for the IUD string after each period. B. The IUD may increase my risk of pelvic infection. C. IUD protects me against sexually transmitted infections. D. The IUD may cause heavier periods initially. Answer: C. Rationale: IUD does not protect against STIs. Strategy: remember IUD equals contraception, not infection protection. Question 25. Which intervention reduces the risk of toxic shock syndrome, TSS? A. Changing tampons every 2 to 4 hours. B. Using tampons at night only. C. Douche after each menstrual cycle. D. Wearing sanitary pads continuously. Answer: A. Rationale: frequent tampon changes prevent bacterial overgrowth leading to TSS. Strategy: think TSS prevention equals frequent changes. Question 26. Which complaint is most typical of uterine fibroids, leiomyomas? A. Heavy menstrual bleeding. B. Hot flashes. C. Severe breast pain. D. Infertility only. Answer: A. Rationale: fibroids often cause menorrhagia and pelvic pressure. Strategy: fibroids equals heavy periods. Question 27. Which is the first nursing action if a woman with a pessary device reports foul-smelling discharge? A. Remove the pessary immediately. B. Teach her to increase fluids. C. Assess for infection. D. Reassure her it is normal. Answer: C. Rationale: foul discharge indicates possible infection, requiring assessment and treatment. Strategy: abnormal discharge, assess for infection first. Question 28. Which nursing instruction is appropriate for a client on hormone replacement therapy, HRT? A. This will completely remove your risk of osteoporosis. B. Report any breast changes or vaginal bleeding immediately. C. You can stop annual mammograms. D. Take it only when symptoms are severe. Answer: B. Rationale: HRT increases risk for breast and endometrial cancer. Strategy: for HRT report abnormal bleeding. Question 29. Which of the following is a modifiable risk factor for breast cancer? A. Age over 50. B. Family history of breast cancer. C. Obesity and alcohol consumption. D. Female gender. Answer, C. Rationale: lifestyle factors such as alcohol and obesity are modifiable. Age, gender, and genetics are not. Strategy: always distinguish modifiable versus non-modifiable risks. Question 30. Which finding requires urgent follow-up in a woman with a breast lump? A. Soft, movable lump during menstruation. B. Firm, irregular, fixed lump with dimpling. C. Tender bilateral lumps before menstruation. D. Breast fullness with pain. Answer, B. Rationale: hard, irregular, immobile lumps with skin changes suggest malignancy. Strategy: hard plus fixed plus irregular equals suspicious. Question 31. Which teaching is most important for a woman with recurrent vaginal yeast infections? A. Wear cotton underwear. B. Take antibiotics for every infection. C. Douching helps prevent recurrence. D. Stop eating fruits and vegetables. Answer, A. Rationale: yeast grows in moist environments, cotton underwear reduces moisture. Strategy: think moisture control for yeast prevention. Question 32. Which sign indicates ovarian cancer in early stages? A. Severe pelvic pain. B. Abdominal bloating and vague GI symptoms. C. Heavy vaginal bleeding. D. Painful intercourse. Answer, B. Rationale: ovarian cancer is often called a silent killer because early signs are vague, like bloating. Strategy: subtle GI plus bloating equals suspect ovarian cancer. Question 33. Which is priority teaching for a client using a diaphragm for contraception? A. Leave it in place at least 6 hours after intercourse. B. Remove it immediately after intercourse. C. It prevents sexually transmitted infections. D. Replace it only if it tears. Answer, A. Rationale: leaving it in for 6 hours enhances spermicide effectiveness. Strategy: diaphragm equals leave in 6 hours post-intercourse. Question 34. A nurse assesses a client with primary dysmenorrhea. What is the best non-pharmacological intervention? A. Apply heating pad to the abdomen. B. Restrict fluids. C. Encourage bed rest only. D. Use cold packs. Answer, A. Rationale: heat relaxes uterine muscles and reduces pain. Strategy: think heat for cramps, cold for injury. Question 35. A nurse suspects a client has endometrial cancer. Which symptom supports this? A. Breast tenderness. B. Heavy irregular vaginal bleeding post-menopause. C. Abdominal bloating. D. Pelvic inflammatory pain. Answer, B. Rationale: endometrial cancer often presents with abnormal postmenopausal bleeding. Strategy: bleeding after menopause equals cancer red flag. Question 36. Which is the most effective protection against STIs? A. Oral contraceptives. B. IUD. C. Condom use. D. Diaphragm. Answer, C. Rationale: only condoms reduce STI transmission. Strategy: condom equals STI prevention. Question 37. Which instruction is key for a client starting tamoxifen for breast cancer? A. This drug decreases risk of uterine cancer. B. Report calf pain or swelling immediately. C. Avoid calcium supplements. D. You will not need regular eye exams. Answer, B. Rationale: tamoxifen increases clot risk, DVT/PE must be reported. Strategy: cancer drug? Always watch for clot risk. Question 38. Which client has the highest risk for osteoporosis? A. A 60-year-old woman with menopause at 52. B. A 48-year-old woman with irregular cycles. C. A 62-year-old woman with early menopause at 40. D. A 30-year-old woman using oral contraceptives. Answer, C. Rationale: early menopause increases osteoporosis risk due to early estrogen loss. Strategy: earlier menopause equals higher risk. Question 39. Which diet recommendation is best for osteoporosis prevention? A. High sodium. B. High calcium and vitamin D. C. High protein only. D. Low carbohydrate. Answer, B. Rationale: calcium and vitamin D are essential for bone strength. Strategy: for bone Ca plus Vit D. Question 40. Which lab result indicates polycystic ovarian syndrome, PCOS? A. Low testosterone. B. Elevated insulin resistance. C. Low LH. D. High estrogen only. Answer, B. Rationale: PCOS is associated with insulin resistance, obesity, and high androgens. Strategy: PCOS insulin resistance plus androgens. Question 41. Which finding indicates vulvovaginal candidiasis? A. Greenish foul-smelling discharge. B. Thin gray discharge with fishy odor. C. Thick white cottage cheese discharge with itching. D. Yellow purulent discharge with pelvic pain. Answer, C. Rationale: classic yeast infection presentation. Strategy: cottage cheese equals yeast infection. Question 42. Which is most important for a woman starting oral contraceptives? A. Report calf pain or shortness of breath. B. Expect increased fertility immediately. C. Stop if weight gain occurs. D. Take breaks every 6 months. Answer, A. Rationale: clot risk is the priority safety concern. Strategy: always teach DVT/PE symptoms. Question 43. Which postmenopausal symptom increases fracture risk? A. Hot flashes. B. Night sweats. C. Vaginal dryness. D. Decreased bone density. Answer, D. Rationale: estrogen decline osteoporosis fracture risk. Strategy: menopause bone loss. Question 44. Which symptom is an early warning sign of breast cancer? A. Persistent, non-tender lump. B. Diffuse breast pain before menstruation. C. Symmetrical swelling in both breasts. D. Discharge during ovulation. Answer, A. Rationale: painless, firm, immobile lumps are warning signs. Strategy: painless lump equals suspicious. Question 45. Which client should not use combined oral contraceptives? A. A 20-year-old with acne. B. A 29-year-old with heavy periods. C. A 36-year-old who smokes. D. A 28-year-old with cramps. Answer, C. Rationale: smoking over age 35 increases risk of blood clots and stroke. Strategy: smoking plus age greater than 35 equals contraindication. Question 46. Which is a typical symptom of PMS, premenstrual syndrome? A. Abdominal bloating and irritability. B. Hot flashes. C. Pelvic inflammatory pain. D. Irregular postmenopausal bleeding. Answer, A. Rationale: PMS includes bloating, mood changes, breast tenderness. Strategy: PMS before menstruation only. Question 47. Which complication is priority after breast biopsy? A. Pain. B. Hemorrhage. C. Fatigue. D. Nausea. Answer, B. Rationale: bleeding is the greatest risk after biopsy. Strategy: post-procedure check for bleeding. Question 48. A nurse educates about Kegel exercises. What is their purpose? A. Reduce pelvic infection. B. Strengthen pelvic floor muscles to prevent prolapse and incontinence. C. Prevent ovarian cysts. D. Increase bone density. Answer, B. Rationale: Kegels help strengthen pelvic muscles and improve bladder control. Strategy: Kegels equals pelvic support. Question 49. Which finding is concerning after a vaginal hysterectomy? A. No bowel movement for 24 hours. B. Temperature of 101.8 degrees Fahrenheit 38.8 degrees Celsius. C. Moderate perineal pain. D. Minimal vaginal spotting. Answer, B. Rationale, fever indicates infection. Strategy, post-surgery infection risk. Question 50. Which education is most important for a woman at high risk of cervical cancer? A. Annual mammogram. B. HPV vaccination and pap smear screening. C. Monthly breast self-exam. D. Genetic testing only. Answer, B. Rationale, HPV vaccination and routine pap smears are key prevention measures. Strategy, match cervical cancer equals pap plus HPV vaccine. Great work completing all 50 NCLEX-style gynecology questions. Remember, success on the NCLEX is not just about memorization but about applying knowledge in real-world scenarios. Continue practicing, reviewing rationales, and refining your critical thinking. With consistent effort and determination, you are building the confidence and skills needed to excel on your exam. Keep pushing forward, you are closer than ever to becoming a licensed nurse.